Conducting implementation research in PNG requires innovative approaches to navigate the complexity of the setting. STRIVE, an implementation research that focuses on molecular, vector, and febrile surveillance, started in 2018 and utilizes a partnership-based approach that is contributing to support the efforts of vector-borne disease surveillance in PNG. The STRIVE Sentinel surveillance sites were strategically selected to address the progressing need for surveillance, rapid diagnosis, and tracking of emerging infectious diseases. These sites include Barrow in West Sepik, Montfort in Kiunga, Hohola in Port Moresby, Boimo in Morobe, Karamoy in Chimbu, Sausi in Medang, Lamacot in New Island, and Escape in Milne Bay. In this video, we capture a brief insight to the different surveillance components under STRIVE. We highlight some challenges of conducting implementation research in a low-resource setting and feature some success stories.
In the malaria program, we have several diagnostic tools that we use to diagnose malaria. One is microscopy, and microscopy is the gold standard. And RDT, we introduced RDT in 2011 after we changed our treatment protocol in 2009. And every health facilities in the country, they are equipped with RDTs. We make sure that our RDTs are at every facilities, that's including the hospitals and right down to the hospital, to the health center level, and also to aid posts. And also we have introduced the new program called HMM program, and RDTs are also at the HMM sites. The volunteers, they use RDTs to do the diagnosis if someone comes with fever. So we don't have any other, like for malaria and vector-borne, the mosquitoes that gives some mosquitoes, all the mosquitoes, they spread all kinds of diseases. And malaria program only concentrate on the malaria part, which is the RDT and microscopy we're doing the diagnosis. But we don't have a test for other diseases that also caused by mosquitoes, like Zika virus and chikungunya, and yellow fever and so on. So at the department, we don't have the RDTs for those specific diseases that are spread by mosquitoes. And so the work that our partners doing, like for example PNGIMR is doing some work on the sentinel sites, they're also going beyond into to see, like after they do the RDTs, and if the RDTs are negative, then they look for other causes. And they are now checking on this Zika virus and chikungunya and all other diseases, and which is a good thing they're doing, because at the department we don't have this information coming from the facility level right up to the NHIS level, because our NHIS doesn't capture all those diseases. Those Zika virus and chikungunya and so they are reported under the surveillance unit. And to date, the program doesn't have the baseline information for those diseases. And so, what IMR is doing, it's a good work that they're doing, because we need to really know the baseline information. We need to know the real prevalence of those diseases, and also the RDTs are not available for Zika virus and for dengue. We do have some RDTs, but it's more centered in NCD and few parts of PNG. They basing on the request that is sent in by the provinces. And so we need to really know the prevalence of Zika virus, yellow fever, and virus and all those, because to date we don't have the baseline information, and we don't know the true picture of those diseases. And these diseases are also spread by mosquito, and they also cause fever. And at the facility level, when health workers do the RDT, and if they find out that if the test is negative, they sometimes can continue to give antibiotics. And like the work that IMR is doing is also going to be a benefit for the program, because we don't have those information on other diseases that are also spread by mosquito.
The program is very honored and grateful to have STRIVE PNG under the PNGIMR that's supporting us in some of the activities that we don't have enough capacity to implement at the provincial level, and like generating data for the program. So we have this mechanism in place by these 8 sentinel sites that send in monthly data of the RDT kits that they are performing at those sites. They're sending the invalid results to the program. So we are grateful to have this mechanism in place to monitor this performance of the RDT at the sites. So because we had reports from the facilities around the country that there are some RDT kits that's giving these invalids. So this mechanism that was put in place is to support the program in generating this kind of data. So we have this data coming in every month, and we monitor the performance of these RDTs. This mechanism gives the program justification on which kind of RDTs that are performing out there. So we see that these ones is giving a lot of invalids, and these ones are really performing well. So when it comes to procuring these RDT test kits, we can have this data in place to justify procurement. And also, like the health workers, like out in the facilities, they have a lot of work to do. They see a lot of patients, and those most severe fever cases, they have to do RDT to confirm whether it's malaria. So like if you have a lot of kids and they're like performing one test on this kit, and then next month there's a different kit again, so you see it's a lot of confusion among the workers. So we have to have this information in place, so when we are procuring and distributing the RDT kits throughout the country, we have a standard RDT.
Right now we have about 6 different RDTs circulating within the country. That is costly. With the data coming in for invalids, we can recommend by using this one to procure 2 to 3. Through this research through PNGIMR, it helps the program to decide which RDTs we can cut down, which will be cost effective.
It's a new sort of a thing that has been around, but it's new in the PNG setting. And for Milne Bay PNG, we are pleased to have a vector control officer alone. So for us, it's a good thing moving forward, since vector is new, and to be involved with the other PNGs is a good stepping stone to learn from them, and also for them to learn from us.
We do have a problem with vector control activities in the province. You can see the surge in malaria cases. So we value vector control partnership, and we are thankful to the IMR for the opportunity to be part of this with other PHAs. We value STRIVE PNG partnership. Especially myself, I do value because of constant communication and updates I received from them. Consistent communication from time to time. We value feedback from partners, and which STRIVE PNG is doing extremely very well with the feedback. They collect data and they do inform us, and we need those data for decision making. It will help us to guide our interventions in our local context. And I'm aspiring to continue to the dialogue with STRIVE PNG, not only the Sentinel site, but with other vector control activities like what we are doing now with the development of microplant, STRIVE PNG. So they're not coming only one agenda, but they are coming in the almost like package type. We are doing collecting data at the same time proposing some interventions to be used.
One of the achievements that I've seen is
the number of cases that we've collected every day caused the number to increase. Like previously, what I've seen was that the number of cases seen in escapes Sentinel site wasn't high. And after when I came inside, and then there were some changes, and also the project was like partnered with PHA. Okay, the environmental health team at the PHA has the connection to Tupaya, so they like monitor our performance too. So when they saw that the number of cases have increased, they came, and we had to go around and do a survey kind of thing with the councillor, and they stepped in to run a project here where they will be coming around and spraying houses.
The STRIVE PNG project partnered with Tupaya in early 2019. Beyond Essential Systems, who are responsible for the Tupaya platform, is a DFAT Centre for Health Security supported partner, and they provide end-to-end healthcare software and solutions for all settings. Their Tupaya platform aims to aggregate and visualize data from multiple sources with the aim of improving medicine availability, mapping and detecting disease outbreaks, responding to disasters, and strengthening service provision in the Indo-Pacific region. STRIVE PNG aims to establish and develop a robust, real-time and actionable vector-borne disease surveillance system, which looks to integrate febrile illness case data with molecular diagnostics, local entomological data, and supply chain data. And for that reason, for that need across the capacity to integrate multiple different data sources, the STRIVE PNG project made the decision to partner with Tupaya as our data integration and visualization platform.
While working under the project, there's some such challenges that I faced. Basically, ESCAPE is it's a center line for all referral centers. So one of the challenges that I face here as a malaria officer and assistant to Lila is that the number of patients that come in different seasons. Okay, sometimes we do not collect patients according to what we expect, because sometimes when they come in, there are seasons where patients come in mostly with malaria cases, and there are sometimes some seasons where they come in with less number of cases, especially in terms of malaria. Okay, so we say maybe January, February, we received a lot of cases with malaria. March, April, a little bit lesser than what we received. So the challenge here is maybe due to the weather pattern that's causing them to flood in with these cases. Yes, definitely the community is, especially ESCAPE, the community is really benefiting from this project due to the fact that we don't only treat and send them home, but we also go out and visit their places and see what are the main factors that are causing them to mainly get infected with this disease, malaria. So yes, it is really benefiting the people of ESCAPE especially. From what we are actually doing today will show us what will we do, what we will actually do in the near future. So for example, like currently, because ESCAPE is not a waterlogged area, the mosquito larva sites usually land only at the water-based areas. Okay, so looking at that, we can be able to, in the near future, we can be able to determine the benefit of the people, and looking at areas where mostly the mosquito larvas set will create that understanding between them and how they get infected with the disease.
Yes, we carry on with our project here. Our friends are very interested in it. Like I said, it's not something that we all learned in school. It's something new here. So as we collect blood samples, so we send data, our friends are very much interested in it. So every day they have a lot of questions to ask, and we will always try our best to answer them as much as we can.
But research is important. There are many questions that we ask, and we need to answer those questions. And there are also many things that we don't know. So in the process of addressing the hypothesis, we may find something that never crossed our mind. Yeah. And then we might find it either useful or harmful. Yeah. So research is very crucial. So for us, within MBPHA, we encourage operational research.
There needs to be more operational research done. Like we are saying, okay, there's malaria happening here, but we need to know what's the cause of it, so we can come up with interventions to sort of resolve the situation. So those situation analyses will only be uncovered when you have more operational research to inform the decision making, and then you can strategize plans on what to implement.
Resources, we are limited to it. Then partners to come in to do those activities for us.
We have different players in health business, and if those players are not engaged, we will struggle with health. So health it's a partnership, and so you can see that our motto in health is that health is everybody's business. Yeah. And so partnership is very important, regardless at a national level, at a provincial level, at a district level, at the LRG level, and at the ward level. Health partnership is important. Whether it be communication, transport, capacity building, we have to do that together. Yeah. And so in this case, it's IMR. IMR is a very important partner in health delivery. So IMR is concentrated in research. And if we can work together with IMR, there are many things that we know, but there are a lot of things that we don't know. So research will lead us to that. So the questions that we ask, the research can help us identify the solutions, the answers, and it will continue to allow us to address the issues before us, the questions that we continue to ask.
We have a lot of data, data sources or database around. We don't have surveillance that's, always there to tell us that something is about to happen. So moving forward, it would be nice for locally, instead of all this data going to one place. Most times you have the outbreak that happens and then the data sort of tells you later. So we are not, responding to what's at hand. So going forward, if some sort of arrangement can happen where we get, data on the spot to react.
We value STRIVE PNG partnership. Especially myself, I do value because of a constant communication and updates I received from them.
With the STRIVE team, we have good communication coming in, not just from the visits, but with updates with Tupaya and that sort of thing. So that's a positive thing moving forward.
So before we could start visualizing our data in Tupaya, we had to go about establishing our Sentinel site surveillance. And we did this by engaging, planning, testing, implementing, and now supporting our PHA and health facility partners to collect data and collect samples to meet the needs of the surveillance system. So we started with engaging with partners in early 2019, and this continued through until 2021 with some breaks due to the pandemic. And what we did is we went out and worked with the provincial health authorities and the health facility partners to discuss which facility would be most suitable and how we'd look about conducting surveillance in that setting.
Communicating with PHA is, I'd say it's very easy for me because I was once working with provincial hospital, so communication with them, it's not that very difficult for me because most of them know me and I know them as well, so communication towards them is not that very difficult for me.
When we have visitors come, is they come and they just, lay out what they want to get from us and they go without any feedback. With STRIVE, we've had experiences of, even having debriefs after their follow-ups, which is a good thing for us because whilst it's good for you to come into the province and do what you need to do, it's also important that we see some feedback before you go. And we've had other programs that don't send any, feedback at all. So we support the Sentinel Center very much. You'll realize and you know from experience that it was a good, sort of partnership arrangement for STRIVE and IMR to come in and sort of liaise directly with the PHA to get someone we know or someone with that caliber to be there.
One thing I like about STRIVE team, we communicate well here with our team in Escape, and also the health facility at PHA and myself. It's important for us to get involved in the meeting because we have a project here in Escape. See, the information, data that we provide to them, it's very important for them as well. As partners, we work together as a team. Well, let's see if PHA is happy with the program or the work we are doing here. I don't think we will have a problem with other projects coming in. They will still come in to or we will have some more projects coming into this province to help them support the health issues here in the province.
Trying to liaise with the officer and see how we can help in that aspect. And it's good to just sit back as a manager and see the discussions going on WhatsApp and just, from time to time just say hi.
The thing I really like mostly about the work is that, it's fascinating to study something that we didn't really learn specifically way back in the college. Okay, especially to do with malaria, we just learned generally about malaria. Getting to know deep within malaria is something that really fascinates me, especially in terms of research towards this project.